Your doctor just scheduled you for a routine screening. You didn't question it. You never do. But what I'm about to tell you might change that forever. Because after 30 years of practicing internal medicine and geriatric health, I can tell you this with absolute certainty. Some of the tests your doctor orders after age 70 are more likely to hurt you than to help you. And most doctors won't say that out loud. I've spent my entire career helping patients over 60 navigate the most confusing part of medicine, knowing when to act and when to leave things alone. And today, I need to share something that goes against everything you've been told about preventive care. There are 5 routine medical checkups that I would never get after the age of 70. Not because I don't believe in medicine, I do, but because I've seen what happens when these tests find something in a 75 or 80-year-old body. And it's not what you'd expect. Before I walk you through each one, you need to understand something that changes everything. It's called the screening math, and it shifts dramatically after 70. When you're 50, screening makes perfect sense. You find a small cancer, you treat it early, you have 30 or 40 years of life ahead of you. The math works. But after 70, 3 things change. First, many cancers and abnormalities grow so slowly that they will never cause symptoms in your remaining lifetime. You would die with them, not from them. Second, your body becomes more fragile. The biopsies, the surgeries, the anesthesia, the recovery, all of it carries higher risk. And third, there's something called the cascade effect. One abnormal finding on a routine test triggers a follow-up test, which triggers a biopsy, which triggers a surgery, which triggers a complication. I've watched this cascade destroy the quality of life of patients who walked into my office feeling perfectly fine. That's not preventive care, that's harm. Now, let me tell you about the 5 tests. Number 1. Routine colonoscopy after age 75. I had a patient named Margaret, 78 years old, from outside of Philadelphia, sharp as a tack, walked 2 miles every morning. Her previous doctor insisted she needed a colonoscopy because she hadn't had one in 6 years. Margaret didn't want it. She felt fine. But she trusted her doctor, so she went. The bowel prep alone nearly put her in the hospital. She became severely dehydrated. Her potassium dropped dangerously low. Her heart started beating irregularly. She ended up in the emergency room before the procedure even happened. And here's the thing. The USPSTF, the United States Preventive Services Task Force, recommends against routine colonoscopy screening after age 75 for average-risk adults. The data is clear. After 75, the risks of bowel perforation, dangerous sedation reactions, and severe dehydration from the prep begin to outweigh the chance of finding a cancer that would actually affect your life. A colonoscopy perforates the bowel in roughly 1 in every 500 procedures. That might sound small, but in a fragile 78-year-old, a bowel perforation can mean emergency surgery, a colostomy bag, weeks in the hospital, and sometimes death. If you're over 75 with no symptoms, no family history, and previous clean colonoscopies, talk to your doctor about whether a simple annual stool test might be a safer alternative. Number 2. Aggressive breast and prostate cancer screening. This one is going to be controversial, so let me be very precise. I'm not saying never screen for cancer. I'm saying that aggressive screening in your late 70s and 80s leads to overdiagnosis, and overdiagnosis leads to overt treatment. Here's what that means. Studies in the New England Journal of Medicine have shown that up to 40% of breast cancers detected by mammography in women over 70 are cancers that would never have caused symptoms or death. They're slow-growing, they're indolent. But the moment a doctor sees the word cancer on a report, the machine starts moving. Biopsy, surgery, radiation, chemotherapy, each one with side effects that can devastate an older body. The same is true for prostate cancer. The PSA test is particularly problematic. Elevated PSA levels are incredibly common in older men, and most of the time they mean nothing dangerous. But an elevated PSA leads to a biopsy. Prostate biopsies cause infection in roughly 5% of cases, sometimes requiring hospitalization. And if they find a slow-growing cancer, which they often do, you're suddenly facing surgery or radiation that can leave you incontinent and impotent for the rest of your life for a cancer that likely never would have bothered you. I had a patient, Gerald, 81 years old, a retired teacher from Baltimore. His PSA was slightly elevated at a routine visit. His doctor ordered a biopsy. They found a low-grade prostate cancer. Gerald's urologist recommended surgery. Gerald went through with it. 6 months later, he was wearing adult diapers and told me he wished he'd never taken that PSA test. His cancer was the kind that a man his age would almost certainly have died with, not from. If you're over 75, ask your doctor this. If this screening finds something, what would we actually do about it? And would that treatment improve my life or just extend my anxiety? Number 3, routine cardiac stress testing. This is the one that worries me the most because it sounds so reasonable. Your doctor says, let's just check how your heart is doing. You get on a treadmill or they inject you with a chemical that simulates exercise. Sounds harmless, right? The problem is false positives. Cardiac stress tests in people without symptoms have a false positive rate of up to 40% in some populations. That means nearly half the time the test says something might be wrong when nothing actually is. But that false alarm triggers a cardiac catheterization, where they thread a tube through your groin or wrist into your heart. That procedure carries real risks. Bleeding, blood vessel damage, in rare cases, heart attack or stroke during the procedure itself. And if the catheterization shows a partial blockage, which is extremely common in anyone over 70, you might end up with a stent. And multiple large studies, including the famous ESKIA trial, have shown that stents in patients with stable heart disease do not reduce heart attacks or extend life compared to medication alone. So you've gone from feeling fine to a stress test, to a catheterization, to a stent, to blood thinners with bleeding risks. And you are statistically no better off than if you'd just taken your medication and gone for a walk. If you have no chest pain, no shortness of breath, and no symptoms, a routine stress test is looking for trouble. And in medicine, when you go looking for trouble in a 75-year-old, you almost always find it. Number 4, routine bone density scans. Now, I know what you're thinking, but Dr. James, osteoporosis is a real problem. Falls kill adults. You're absolutely right. Falls are devastating. But here's where the logic breaks down. A DEXA scan tells you your bone density is low. Your doctor prescribes a bisphosphonate medication like alendronate. You take it for years, and then something ironic happens. Long-term bisphosphonate use is associated with atypical femur fractures, the very kind of break you were trying to prevent. These medications can also cause severe jawbone deterioration, a condition called osteonecrosis of the jaw, which is painful and difficult to treat. Meanwhile, the single most effective intervention for preventing fractures in older adults isn't a pill. It's fall prevention, balance exercises, removing throw rugs, installing grab bars, checking your vision, reviewing medications that cause dizziness. These simple steps reduce fracture risk more effectively than any medication without a single side effect. If you've already had a DEXA scan and you're on medication, don't stop it without talking to your doctor. But if your doctor is suggesting a routine DEXA scan and you've never broken a bone, ask whether a fall prevention program might be a better investment of your time and energy. Number 5, routine carotid artery ultrasound screening. This is the test that sounds the most logical and maybe the most dangerous. Your doctor puts an ultrasound probe on your neck and checks for blockages in the arteries that supply blood to your brain. They find a 60 or 70% blockage. Sounds scary, right? Your doctor refers you to a vascular surgeon, and now you're facing carotid endarterectomy, a surgery to clean out that blockage. Here's the problem. If you have no symptoms, no many strokes, no episodes of vision loss, the surgery to prevent a stroke carries a 2 to 3% risk of causing the very stroke it's trying to prevent. And in older adults, that risk is even higher. The USPSTF specifically recommends against routine carotid artery screening in adults without symptoms. Their analysis found that in asymptomatic patients, the harms of surgery, including stroke, heart attack, and nerve damage, outweigh the potential benefits. I had a patient's family call me after their father, a 79-year-old named Robert from Delaware, had a carotid surgery following a routine screening. Robert went into that surgery walking, talking, and living independently. He came out with a stroke that left him unable to speak clearly for the rest of his life. The blockage they fixed had been there for years and likely would have stayed silent. But the surgery to fix it caused the exact catastrophe everyone was afraid of. Now, I promised you something practical. So here are 4 questions I want you to memorize. Write them down. Put them in your phone. Bring them to every doctor's appointment from now on. I call this the 4 questions protocol. Question 1. What exactly will this test look for, and what happens if you find something? Question 2. If you find something, what would the treatment be, and what are the risks of that treatment at my age? Question 3. What happens if I don't get this test? What's the actual risk of doing nothing? Question 4. Is there a less invasive alternative that gives us useful information without the same level of risk? Any good doctor will welcome these questions. If your doctor gets annoyed or dismisses your concerns, that tells you something important too. I want to be very clear about something. I am not telling you to avoid all medical care. I am not telling you to ignore symptoms. If you have blood in your stool, get a colonoscopy. If you have chest pain, get a stress test. If you've had a mini stroke, absolutely get that carotid artery checked. Symptoms change everything. What I am telling you is that routine screening, the kind where you feel perfectly fine but your doctor says, let's just check. That kind of screening has a different risk-benefit calculation after 70, and you deserve to know that. For 30 years, I've watched patients walk into a screening feeling healthy and walk out of the cascade feeling broken. Not because anyone made a mistake, but because the system is designed to find problems and treat them regardless of whether treatment makes your life better. You have the right to ask questions. You have the right to understand the risks. You have the right to say, not right now. You have the right to say no. Your body, your choice, your life. If this helped you see your healthcare differently, subscribe to this channel. I make videos like this every week to help you make informed decisions about your health after 60. And leave a comment below. Tell me, have you ever had a screening that led to more problems than it solved? I read every single comment, and your story might help someone else make a better decision. I'll see you in the next one.